Alpha coma pattern is a specific EEG pattern seen in patients who are comatose. This EEG predominantly consists of alpha frequencies. So let's review some of the normal alpha frequencies in otherwise normal individuals. When you're looking at the EEG, a quick reminder, you look at the left hemisphere of the brain. So all the odd numbers here, let me mark it down. So these are all odd numbers on this side. These odd numbers tell you that you're recording electrical activity from the left hemisphere of the brain. All the even numbers here show you that you're recording electrical activity from the right side of the brain. Alphabets F, C, P, and O tell you the location on the scalp where this electrical activity is being recorded from. So F3 is left frontal, F4 is right frontal. In a normal adult person, in a normal individual during quiet wakefulness, you see alpha frequencies predominantly in the parietal occipital head region. So over here, these frequencies, this is alpha frequency. The distance between the two dark green lines, so this is one of the dark green one line here, and this is the other line here. If you count the waves between these two lines, you will find a frequency of 8 to 12 hertz, that is 8, 9, 10, 11 or 12 waves. If that is the frequency, you call it alpha frequency. In normal adult individuals, alpha frequency is predominantly seen in the posterior part of the brain. If you look on the anterior head region, so let me draw another square here. So if you look in this area here, this is beta frequency, so it's a fast frequency. Looking over here on the right side as well, you see this is beta frequency. So in a normal individual, normal awake individual during quiet wakefulness, alpha frequency is in the posterior head region and beta frequency is in the anterior head region. Another feature of a normal alpha is that it is reactive to eye opening and closing. So what you see here, so let me draw here. So these are eye blink artifacts. This what you see here, these are eye blink artifacts. I'll use a different color. So these are eye blink artifacts. And these are eye blinks, and this is eye closure. This again, here, this is eye closure. So eye closure artifact is seen in the frontal regions because that's closest to the eyeballs. And as soon as the person closes the eyes, you see alpha frequency appear in the occipital head region. This is an example of a normal EEG. Number two, the second feature of a normal alpha frequency is that on eye opening, so on the previous page we saw that on eye closure the alpha frequency was more pronounced. So look at the alpha frequency here. And what happens with eye closure? So let me draw it here. So I'll use a green color again. So this is eye closure. This is eye closure artifact right here on both frontal regions. As soon as a person closes the eye, the alpha frequency disappears. So in a normal awake person, on eye opening, the alpha frequency disappears, and on eye closure, the alpha frequency becomes more prominent. Now let's talk about alpha coma. What do you see here? You see alpha frequency, so let's draw some lines here. These are 1 second. This line is separated from this line by approximately 1 second. And you see alpha frequencies that are distributed not just in the parietal occipital region, but you also see alpha frequencies in the frontal head region. So alpha coma pattern on the EEG is a specific pattern consisting of alpha frequencies that are distributed both anteriorly, meaning closest to the frontal head region, and posteriorly, close to the parietal occipital head region. The other feature is these frequencies are non-reactive. On the previous pages, you noticed that on eye closure, the alpha frequency got more pronounced. On eye opening, the alpha frequency was attenuated. But here, what you're seeing is the alpha frequency persists. With we do not have eye blinking here, so it's hard to say whether it would have changed. But on external stimulation, you can give some kind of a painful stimulation to the patient. You can just make a loud sound and see if the alpha frequency changes or not. If the alpha frequency does not change and it is distributed anteriorly and posteriorly in a comatose patient, you call the EEG pattern as alpha coma. There are a number of conditions that can give alpha coma. You can see that in patients who suffer anoxia from cardiac or respiratory arrest. Severe prolonged hypoglycemia can lead to alpha coma. Bilateral destruction of midline thalamic nuclei can lead to alpha coma. Alpha coma has also been described with electrical injuries and with drug intoxication. Although the prognosis of patients for functional recovery after in association with alpha coma is considered poor, but it depends on the underlying etiology. So a relatively good outcome has been reported in patients who've sustained electrical injuries and drug intoxication, and not as good in patients who've suffered from anoxic brain injury. Thank you.